Now let's look at some examples of nasal bone fractures. As we scroll up here, you begin to see a break immediately here, a step off here, and a displaced fracture here. Although it may be confusing at first, let's start by looking at the normal right side so that you'll be able to see relevant anatomy and analyze where these fractures actually are. Remember, when looking at the axial view, the first thing you're seeing here is actually the frontal process of the maxilla. In our anatomical picture we showed you before on anatomy, that was lateral to your nasal bones, and the connection between the two is seen here. Although it looks like a break, this is actually the suture line or your nasomaxillary suture. This is in between your nasal bone and the frontal process of your maxillary bone. So any fractures seen posterior to the suture line are fractures of the frontal process of the maxilla, whereas any fractures seen anterior to this line are fractures of your nasal bones. As we continue to scroll up, you can see your nasal bone on the right side here. So now let's look at our left side. Starting from the bottom, as we go up, we can see that original fracture we saw, which now you know represents a fracture of the left frontal process of the maxilla. In addition, we see a step off here, also indicative of a fracture. However, as we go more superiorly, you're able to see here a fracture of your left nasal bone. Although you can see this in the axial view, you always want to compare with the second view. So, for example, let's pull up our coronal view and use our 3D cursor to show where that break is. As you can see here, on your left nasal bone, you have that displaced fracture and a gap in between the segments. In addition, if you go slightly more posteriorly, you can also see the fracture of the frontal process of the maxilla as shown here. Now let's finish off this example by looking at the sagittal view. First, here we can see the fracture we were speaking of before in the frontal process of the maxilla. And then we can also see the break in our left nasal bone. It's difficult to see on the sagittal view. It's much easier to appreciate on the axial and coronal views. But that's why it's always important to look at everything in 3 views. As you begin to look at more and more sagittal views of the nasal bones, you'll begin to become more and more familiar with how it looks with the fracture and how it looks when it's just normal anatomy. So at this point, we'd be ready to diagnose this patient with the left fracture of the nasal bones, as well as the frontal process of the maxilla. Let's take a look at a second example now. As I scroll up, you can immediately recognize that this is a very complex comminuted fracture involving both the nasal bones, the frontal process of the maxilla, the nasal root, and even in the septum, which we'll get to later on. Always remember, the best way to approach every CT scan is in a step-by-step manner and taking it one set at a time. This will break things up for you and allow you to identify one fracture at a time and then get a better picture of the overall state of the patient later on. For example, as we scroll up, let's start off with the left side of the patient. We immediately see a break right here, indicating there's a fracture of the left frontal process of the maxilla that's extending to include the nasal bones, and these nasal bones are fractured in a comminuted fashion, meaning they are broken into several different pieces. Moving on to the right side, we once again see a similar fracture pattern involving the right frontal process of the maxilla, extending anteriorly, resulting in a right comminuted fracture of the right nasal bone as well. In addition, superiorly, we can see a separation between the nasal root and the nasal bones inferiorly. The nasal root is connected to the perpendicular plate of the ethmoid bone, and that's what you're seeing here. Inferior to this, we see our bony part of the septum. And as we can see here, there's a fracture in the septum. The septum is not a piece of anatomy that we have talked about previously. However, it's very important to always look at it radiographically and clinically because there can be certain features that warrant immediate attention, for example, a septal hematoma. As shown here, we see a fracture in the septum, fracture of our nasal bones and frontal process of the maxilla. So at this point, we'd be ready to say that there is bilateral fractures of the frontal process of the maxilla and nasal bones, as well as a fracture of the bony septum. Let's pull up our coronal view now. And once again, as you scroll through, you can see on both sides fractures of the frontal processes of the maxilla and the nasal bones in a comminuted fashion, as well as here, you can see the fracture of the bony septum and its separation from the perpendicular plate of the ethmoid bone, which is right here. After scrolling through fully and re-identifying all our fractures, you'd then move on to your sagittal view, which will provide more detail on where the fractures are located and where the fragments are displaced. As you can see here, the sagittal view provides crucial information as to knowing in which direction the fragments are displaced, as well as what will be involved with your eventual treatment. That concludes our second fracture example. It's now time for you to practice identifying fractures in nasal bones. However, as you'll notice, the most important thing when regarding the nasal bones is to get used to regular anatomy versus abnormal anatomy. Therefore, going forward, you'll be asked to examine the nasal bones on every CT scan you look at in all future modules. Always make note of whether or not there is a fracture in the nasal bones, and make sure to include this in your report when you're doing your practice scans going forward.